Your feet.
So, okay, so but I'm just doing that because I don't know if you can see that I don't really have any weight through my feet. They're in contact, but there's no weight. So my preset in sitting, when we're thinking of weight shift, what's the question really asking? Where am I weight bearing through? To have core stability with mobility, we preset them with the right leg a little bit more in front, the right hand here. We make sure everything's locked. So just altering, that's doing their weight shift. So they don't have to have controlled mobility on stability. And then they come forward, sagittal plane, they go into the transverse plane, back and down in the sagittal. You would help them into this position, and you document that. A patient required mod assist into a preset. Initiate it with the arm going out, and that's their weight shift. So it goes forward in the sagittal and lateral in the frontal plane. Weight shift goes onto the right arm, right buttock, and onto the right hamstring and the right entire surface of the foot. The patient then goes in the sagittal plane and weight shifts until weight is accepted greater onto the right foot, right hand, and now they weight shift slightly more to get weight onto the balls of the feet, right greater than left, and then rotation in the transverse plane, and then going down into more knee flexion, and then returning into knee extension. The more their inability to weight shift effectively, you're going to do shorter arcs. So if they can't get to the balls of their feet, or they're not able to weight shift and they're really weight bearing through their legs, but it's not more biased towards the right or towards the balls of their feet, you need to do short arc. So and do more like this. Reposition the feet, and then over. So in terms of training of doing squat pivot transfers with neuro patients, I start off, in an acute hospital setting, them going towards the right side. I start off with teaching the preset and having them do short arcs, reposition the feet, transfer, reposition the feet, and then go over. If you are in doubt that they have the ability to do it, again, we're going to block the sound side. Okay, so your leg is there, and you're going to guard them. So when we're doing a squat pivot transfer, and we're just watching them move, where do we want to be?
Right in front of them.
We want to be right in front of the patient. What does that do in terms of my mechanical advantage for my quads, my glutes, and hamstrings? Right, so I'm at a mechanical advantage. I'm not going to be I don't have to overcome as much weight transfer to get to my pivot point.